And I am now going to welcome Josh and Aaron. I go through that part fairly quickly so that now you have the stage, and I'm actually going to see if I can spotlight both of your screens. There we go.
Here I am.
And add spotlight. There you two are. So please, thank you so much for coming and for sharing your sharing what Toronto Public Health does for noise with us tonight.
For sure. I mean, so I can reintroduce myself. I know Ingrid did there, but yeah, my name's
Yeah,
Josh
please.
Murray. And I'll just say that the team I support in Toronto Public Health is called Health Protection, which has two large buckets. One is communicable disease, but the other side is environmental health, and that includes health hazards. And that's kind of how TPH has functionally defined noise and how we work, the team that manages that. So I'm the policy lead for that team. And as most of you know, we have a report coming up on April 1st at the Board of Health. And so that's why we're here to hear some of your feedback before that meeting and to communicate a little bit about, some of our thoughts. We can't say everything because the report's not published yet, but we're excited to hear your thoughts, and even that first question about what you think is TPH's role is interesting and helpful. And I'll pass over to my colleague Erin to introduce herself too.
Hi, everyone. I'm Erin. I'm a Policy Development Officer at Toronto Public Health. And like Josh said, we both support a directorate within public health called Health Protection. And we work on all sorts of different things. And noise is one of those big chunks of our work. So we're very excited to talk to you about all the stuff that we work on with regard to noise and hear your thoughts. Thanks.
Okay, so I'll share my screen with the presentation. Can folks see it? Okay. Okay, so I know that folks have already started talking about this, but we do want to acknowledge and we'll talk a bit about the history of TPH's work in noise. But we have historically, and this upcoming report will continue to highlight the health impacts of noise, exposure to excessive noise, and that those health impacts, of course, go beyond hearing loss and touch on the known health outcomes of cardiovascular health, cognitive health, sleep health, and mental health. And a lot of those are interrelated to one another, of course. And those are the known health outcomes that have consistent and significant evidence in the literature. There's other areas that are emerging, but the evidence isn't quite as strong yet. So we try to focus on those areas that have the evidence base from a public health standpoint. The most significant contributor and what we call environmental noise, because that's how Toronto Public Health again thinks of these exposures. It's at a public health Toronto citywide level, is of course traffic. So that can, as folks have said, talked about motorcycles, talk about illegally modified mufflers. Our noise monitoring study from 2017 identified that traffic contributes to about 60% of the noise levels that you're hearing. So obviously there's other factors, but that's the main component compared to, of course, there's other areas like construction and waste collection and others, amplified noise, of course. I also want to highlight that a number of the studies that we have sourced for our report and that we base the evidence on do take place in Europe often because they're a bit further along in terms of this work. And so it's always a bit tricky for us to apply that to a Toronto context. And of course, it's a neat different context. Those studies are often a bit older too. There's a couple of main ones in terms of environmental hazards that include noise, and they're from about 2014. So that's also part of our analysis too, is trying to note the strength of the evidence that does exist. And we also know that the health outcomes that noise impacts are also impacted by other factors. So that's one thing we want to touch on too in the report, and that we can explain here in the next slide. So it can be difficult from a scientific perspective to isolate and quantify the impacts of noise to your health versus other impacts. So folks are exposed to a number of things that can impact your health. For example, with cardiovascular health, can also be impacted by the air quality. And air quality is also impacted by traffic, just like noises. So there's some areas that Toronto Public Health supports where there can be co-benefits. So if you're taking action to advocate for more mass transit or active transport, for example, those are actions that can benefit both noise and air quality. And so we do try to look at those areas where there's co-benefits and want to acknowledge that a lot of our work touches on those because, as Ingrid says, like we think of noise as an environmental health hazard because it is one of those things that you can't control, like air quality. You're exposed to it regardless of your individual choices or behaviors. And so it's a bit more of that population level focus that we do have. There are, of course, other social determinants of health too, like access to food, socio-demographic factors that contribute to the same health outcomes as well. And again, just trying to highlight that from an evidence standpoint, it can be difficult to parse these different factors from one another when we're trying to identify the specific impact of noise itself. Okay, I'll pass it over to my colleague, Erin.
Thanks. So I'll go over some of the roles and responsibilities that each of these different players has in noise. I'll start with ourselves, Toronto Public Health. So as many of you identified, we provide a health lens for policy at the city, and we recommend ways to improve health outcomes through our own activities and through the activities that are managed by other city divisions, and through policy change that goes to a number of different committees. However, we are not responsible for enforcement of bylaws. We do a couple of enforcement pieces that are specifically relating to the Health Protection and Promotion Act. But for noise, enforcement is administered by the Municipal Licensing and Standards Division. And they take care of all of that. So all of the complaints that you're making to 311 go straight to Municipal Licensing and Standards, and they administer all the enforcement pieces for that. The Ontario Ministry of Environment, Conservation and Parks, they set environmental noise guidelines for Ontario, and their ministry recommended levels for outdoor noise are 55 decibels and 40 in sleeping areas, and that's for road traffic noise specifically. And then the Ontario Ministry of Health sets requirements for activities that are conducted by public health units. So for us, they set the Ontario Public Health Standards, and that includes mitigation of environmental health hazards of different sorts broadly. So next slide, please. So at Toronto Public Health and at the city, we've taken action to address noise over a few years now. In the past, we've talked about just a few minutes ago, in 2017, we published the environmental noise study, How Loud is Too Loud? And as Josh said, we found that over 60% of residents experience noise levels above that 55 decibels during the day. And we also found that our noise levels here in Toronto were similar to those in Montreal and in Vancouver, and I'm sure elsewhere as well. Then in 2019, we published the Noise Action Plan, and we described ways that the city could reduce noise and mitigate exposures to noise. And that was for all city divisions, leveraging the city council directive that we had to create the Noise Action Plan. We suggested ways for all city divisions to take action there. So then in 2024, as a result of all of this, we collaborated with MLS to review the implementation of the noise bylaw, and there were a number of key changes for the noise bylaw there. And in our report that you'll see on April 1st, we'll include some fulsome updates on the status of all of the recommendations that we made to other city divisions in the Noise Action Plan and some key changes that occurred as a result of that noise bylaw review. And then on an ongoing basis, we are working with other city divisions to keep promoting a healthy environment, promote physical activity, promote healthy aging. And we also consult on large development, transportation, and infrastructure projects where noise impacts can concern community members, and especially where they are exempt from the noise bylaw. So we do that broadly for a number of health hazards, and that includes noise as well.
So yeah, no, it's just a quick presentation. We do have here in terms of questions, we have a general email that is the medical officer of health at toronto.ca. And if you submit questions or feedback there, that gets filtered down probably to us. And then we can also build that into our responses at the Board of Health and also just our work on an ongoing basis. And so I know that we went through things pretty quick there, but we really wanted to leave room for questions and really just provide that overview of TPH's role, the report that's coming up to the degree that we're allowed to speak to it. And hopefully that was helpful to understand the role that we play versus some of the other partners.
Excellent. Well,